Good afternoon, everyone. Thank you for joining me today for our session, Getting Started with HIPAA Compliance. This is the second in our series talking about regulatory compliance. If you missed last week's, it is up on our YouTube channel, which can be easily accessed by going to our website, stcntech.com, and clicking on the YouTube icon. And thank you for coming. I appreciate your time and effort today to be here. So we're just going to get right into it. What is regulatory compliance and why? Regulatory compliance is the practice of following the rules set by governments or other authorities. So we think governments, our government, set certain rules to help protect businesses, to help protect organizations, and to help protect individuals. And then there are other governing authorities that you may be licensed by. So when we think about that in the context of HIPAA and healthcare, your state medical board or other similar entities that may give you rules and regulations to follow. Now, those don't, the medical board does not necessarily talk about HIPAA. HIPAA is about insurance, but there are other governing bodies, not just the federal government or the state government or the local government. It extends beyond government. The regulatory compliance and the regulations that are delivered to us can cover items such as physical items. So we think about physical items, rooms, papers, cabinets, things like that. Data, that's the one that kind of jumps out at us, right? We like to talk about data a lot here, but we go beyond that, and we'll talk a little bit about how we go beyond that today. Think about documenting processes and other standards. So there are some regulatory bodies that not only want to make sure you are securing your data and securing your, in this case, patient records, but they also want to make sure that you document the way you do it, that there are policies, procedures, and processes in place that make sure that every single time you do something, you do it the exact same way, whether John is doing it or Jane or whoever might be working on it. They have a documented procedure to follow every single time. Every business that processes or holds data, personally identifiable data that is attached to a client, a customer, or financial information, things like that. Every business that does this is required to adhere to some type of regulatory compliance, whether government or an association or a regulatory body of some sort. Compliance to these regulations. So these regulations exist to ensure that the information that we are entrusted with stewarding is secure and safe when it is in care of us. Because our clients, our patients, our customers, anyone who gives you their information is trusting that you will take care of it in a responsible way, that you will communicate to them how you're going to take care of it. When we talk about GLBA on our next session, communication is very important when it comes to the GLBA regulations. But not so much, but the GLBA is very in tune on that. And why the government says so. And if you don't comply, you're in trouble. What does trouble mean? In this case, as we dive into HIPAA, first offense, the fine can be as little as $100 or it could be $50,000. So that's your range of fines that you can get for HIPAA for violating the HIPAA regulation. It's up to $50,000 for each incident. So for example, if you have a situation where you're not complying, let's say with 10,000 records, in theory, you could be fined $50,000 times 10,000. So it's just something to think about when you think about, well, I take care of my records. I don't need to pay attention to what the government says I need to do about it. You do. If you're found to not be in compliance, it can hit your bottom line pretty significantly. So let's talk specifically about HIPAA now that we know how much money it might cost us to not comply with HIPAA. HIPAA is the Health Insurance Portability and Accountability Act. HIPAA was put into place, I don't know, 30, 35 years ago. I should have put the date on the slide, I guess. I don't remember what it is off the top of my head. It was put in place in order to ensure that certain standards would be followed by all, in this case, to begin with, healthcare providers. It's changed since then a little bit, but anyone who handles health information that connects to health insurance must follow the standards that have been laid out. And those standards, we'll talk a little bit about them today because we're talking about getting started with it. So we're going to talk about the basic foundation of how we get compliant with HIPAA. The important takeaway here is if you handle any information that goes between a client and their insurance company, and you are the steward of that, you must comply. HIPAA says so. Now, HIPAA initially is pre-data. So HIPAA was mostly designed to protect the data that's on paper. That was the idea initially. We have to these filing cabinets. What do we do with them? But what it means is that protecting your patient data is of paramount importance to you and obviously your patients. You would hit your bottom line and hit your reputation if you don't. And your patients, if their data gets leaked or is out there or is mishandled in some other way, that can impact their lives in a way that is irreparable. Lehigh Valley Health Network recently, it was about 9 months ago, had a doctor's office that was breached and all patient data was leaked. I was on television with the Blue Ridge News Network talking about it. We had a satellite doctor's office that simply did not take data protection seriously, and they were breached. And all the patient records were released. I do not know what the fine was. I do not know what the financial impact of it was off the top of my head, but it was a very serious thing. It was all over the news. You probably heard about it. And I'm sure you can Google it. It's out there, trust me. Lehigh Valley Health Network, data breach, doctor's office. I want to say it was early in the fall of 2023. It might have been in the spring. Can't remember. I mentioned that this HIPAA was designed with the idea of file folders, file cabinets, protect your patient's information. Make sure that you're transiting in a secure way from point A to point B. But they've added EPHI. EPHI is the Electronic Protected Health Information addendum to this. And what that does is it sweeps in the idea of digital data. It extends HIPAA protections to ensure that electronically stored and accessed data is protected at the same level, the same regulatory rigor as HIPAA defined for paper record. So EPHI and HIPAA hand in hand, different regulations, same regulation in the end, because they both exist to protect the data that you as a health care professional have been entrusted with. All of this includes how you process, store, and report on your data as it relates to your customers, clients, patients. So why do I say customer, clients, patients? I said healthcare professional. Well, this does apply we're gonna go ahead and move forward real quick, because this does apply to any organization that handles or processes patient information as it relates to health insurance. So for example, if you are a doctor or a chiropractor or dentist, or I don't know, pick your healthcare related profession and title. If you are in that boat and you do not take health insurance, this does not apply to you. I'll say it again. If you do not take, process, collect information regarding health insurance, this does not apply to you. However, if you take insurance for anything, you take health insurance for anything, if you're a dentist, if you're a doctor, if you're an eye doctor, if you're a chiropractor, if you're a foot doctor, if you're a whatever, if you take health insurance, HIPAA matters, and you must be secured and comply. Okay. All right. So so what I was saying was that it's not just doctors' offices. There are health insurance clearinghouses, people who process and sell healthcare, who sell health insurance, brokers, all those offices HIPAA applies to. It's not just doctors' offices. It's more than that. And that's important to remember as well. One of our newest clients here at STCN Tech is a company that I'm going to say sells health insurance. You know, it's the marketplace. They work with all the different brokers and vendors. They do collect and process health insurance information as it relates to personally identifiable patient information. They must be compliant. Now, compliance for them is different, or it looks different in the end than compliance for a doctor's office with 5 doctors and 15 staff members. It's a different look than a company that is fully remote with 10 salespeople, right? So it's a different process. We look at it in a different way because the things we have to secure are actually different. I mean, the devices, the physical pieces, the data itself is not. It may also extend to organizations that you do business with as well. So we think about those brokers, and we think about you know, anyone that we may transit that information to and from. All personally identifiable information associated with your patients is what is covered here. Everything, all of it. You're processing health insurance, it's all connected. You could get down with a fine-tooth comb and weed out some information. Sure, you could. Not worth it. Just protect the data, protect your patients. HIPAA relates to physical copies. PHI adds electronically stored data. I've said a couple times, but it is important to remember that HIPAA with EPHI doesn't just extend to data security. It also extends to your filing cabinet full of papers, because that's what it was originally meant to do. Today, a lot of offices forget that. They forget that matters. They forget that they have to keep records for a certain amount of time. They forget they have to store them securely in one way or the other. For our part, one of the things that we have talked to offices about doing and work with them to do is to take those paper copies and make them digital and store it in a place that does not take up boxes and boxes of tons of square footage full of boxes in a facility where they have to pay monthly on it. Instead, digital, smaller footprint, smaller cost, less risk in that area. So what kind of safeguards do we need to think about when we think about HIPAA compliance, specifically HIPAA compliance as it applies to your business or organization? What safeguards do we really need to consider? We have to start from the administration of information. We need to think about and target the policies and procedures and reporting methods that exist within your organization in order to know how things are I don't want to say handled, that's the right way to put it, how things are worked through. How do you process data? How do you store it? What are the policies and procedures that everyone goes by? And then more importantly in there is how do you report on it? How do you know what is actually happening? The reporting part is very important to stay compliant. Reporting in this particular context is not part of the regulation. The regulation doesn't say you need to have a report about where you put your files every day. You just need to know. You need to be able to produce them. But reporting on it and having a check and a balance in place allows you to know Jennifer did this today. John did that today. You know because you have reports on it. Physically, we need to focus on how things are secured and how we have access to those places and spaces and how we govern that. So what are the places, how are they secured, and who manages it and knows who comes and goes? And finally, the electronic controls that include protecting the data, whether it's at rest, in transit, access control and governance of that data, who has access to it and why, how they get access to it. Very similar to the physical layer here that we talked about, but now it applies to data. And I'll probably talk about it in a minute, because I probably forget I said this, but your data has a physical location and component to it as well. Just because it's electronically stored doesn't mean the physical location of where it is doesn't matter. It does. So let's jump in and talk about how does STCN Tech look at and provide help for the administrative portion of this conversation. We start every project with an assessment. And that's just what we do. No matter what we're doing, we assess what you're doing, why you're doing it, how you're doing it. We want to find out what the rationale behind it is, what your processes look like, kind of how you go from point A to B to see why you're doing it that way. We assess your policies, procedures, and reporting, and we talk to the people who are doing it. We meet with key stakeholders to learn why this is happening in this way. Because as much as you may have a policy that says file this here or there, people may not be doing that, and there might be a reason. So administratively, we want to know that in order to work forward in the process so that you can have good reporting on it. Create a plan of action report that details what we've learned and then how we think from an administrative standpoint it could be improved, maybe where there is not compliance in that area. So that's the administrative side of things. We help document, we help assess, and we help report on it, and we help to improve those areas through meetings, discussions, and examples. Let's talk about the physical security. How does STCN Tech help with that? Well, we assess everything before we start. We don't just jump in and start doing things. We assess how you're securing your physical plant, your building, your cabinets, your data centers, your drawers, your desks. How are you securing them today? And what does that look like in a practical sense? You may have secure doors, but how? How are they secured? Are they secured with a swipe card, like in the picture? Are they the punch codes with the numbers on them? Or are they just key locks? We meet with key stakeholders, just like before, but this time we're talking about information security. So information security does include electronically stored records. And you're going to see on the next slide, I separated out so we can talk about the security, because in many organizations, so in some, I won't say many, in some organizations, the people who are in charge of securing file folders right? So you have cabinets that are physically locked and they're locked in a room. The room is locked. They are sometimes the same people who are responsible for the data security, and sometimes they're not. It's, there's no one answer either way for sure that we've seen has been largely the same across the board. It's just not that way. It depends on how organizations are built. So this may be 2 meetings, it may be 1. But we want to talk about how you do it, what the processes are, and your documentation of how you do it. Then we work with key stakeholders and vendors such as Vigilon to ensure full physical security of data. So what does that mean? And by data, we're talking about papers, we're talking about computers, we're talking about everything. Vigilon is our partner that helps us provide security solutions, cameras, door access controls, things like that. Because you need to know who went in, when they went in. You need to have evidence of them coming and going. And Vigilon's security products help do that. Vigilon was one of the pioneers in license plate reading technology cameras. So they're very good at what they do. And we have partnered with them to help secure everyone. How do we do it on the tech side? Tech security. The tech security is what we do. We assessment for securing data. So if we talked about physical security, securing your data, physical security matters. Do you have a server where you store your data in your office? Well, who has access to that? It's as simple as that. Who has access, when, how, all of those things matter. It's very, very common that network switches or even servers are underneath somebody's desk, in a closet that's never locked, that was a coat closet and now it's not. We bring expert level tools and experience to this conversation so that your data is secure, whether it's in a coat closet or offsite in the cloud at a provider. We make sure those providers are secure. We work with secure providers that help do these things. We meet with the key stakeholders, and maybe the same people who do the paper portion of the process. Might be different people. Could be 1 meeting, could be 2. We meet with those key stakeholders, talk about data security, talk about the process procedures, the things you're doing today to make sure that when somebody gets up from their computer and walks away, that screen is not available for anyone to walk up and look at. We make sure that when people leave spaces where data, where protected data, personally identifiable data exists, that someone else can't just walk up and access it. We make sure that people can't get it from the outside. We make sure that people can't walk into your office and get in to it with their own devices. All of these things matter. So your processes and procedures need to account for all of those things. And then we implement market leading tools with backend protection to all your data storage to make sure that when you are typing in patient information, when you're typing in client information, and you have it on the screen in your data product and click submit or click OK, and it goes to save it, that it is encrypted from one end to the next. When you walk away from the workstation with the report on the screen, that the workstation locks and the authentication is protected at the highest level so that you can't just get in. When you go from one end to the next, whether it's on your screen, saved to a hard drive, saved to a server, saved to OneDrive, all encrypted, one end to the next, done. And we work with market leading providers to help do this. So what we often get from folks is, okay, we heard what you said. We got this. We can do this. Why do we need an external professional to help us with this? We've got a couple of guys that can do it. They can do it. But we start with objectivity. We are objective. We are coming in, looking at the regulation and applying it to what you do. We aren't looking at it and saying, well, we don't really need to do this because it's hard, or that this takes so much more work. What we are doing is looking and saying, this is the effort that's required. This is the amount of time and work that goes into it. And it requires this many man hours to continue. And we, as an external provider, can also help provide those hours when you don't have them internally on your staff. So from an external professional standpoint, we provide the objectivity and ability to say, this is what is necessary, and here's how you get there. We provide expertise. We have market-leading security certifications on staff and available. We provide the expertise of working with many different organizations, protecting many different types of organizations' data. We provide that, and an external professional has seen, generally speaking, has seen more types of situations than internal staff usually has, because this is what we do. Risk reduction. So our eye is towards reducing your risk. Every organization, every process, every time you type something in a computer, there is a risk associated with that, and you can't just get away from it. The risk is there, no matter what. So when we accept that there is risk, the question becomes, how do we reduce our exposure to that risk? And that's where your external provider can come in and say, well, if we do this, we reduce the risk this much. If we do this, we've reduced the risk that much. And we are candid and objective with that assessment in a way that allows the key stakeholders in the organization to make informed decisions that align with their mission and objectives. And in this case, the mission is to become compliant. So it's a very important mission that does have some wiggle room in how you become compliant. The point is to become compliant. Increased accuracy. So we have one person doing a job, and that one person then has to go to another job. They're not doing something different than they were doing a minute ago, and then they have to go back to that other job. And it's kind of a little bit of a back and forth to see whether or not they have this or they have that. When you hire an external professional, when they are working in your space, they are working in your space. They are focused and targeted on the work required to get you compliant. Because again, that's what they do. They aren't worried about whether Jack can print. They aren't worried about whether Renee's new monitor is plugged in properly. They're not worried about those things. What they are worried about is your regulatory compliance. Alignment with organizational mission objectives. I mentioned that a second ago. Everything that we as an external professional at STC and Tech provide aligns with your organizational mission and objectives as you present them to us. That's what we do. We aren't going outside those mission and objectives that you've presented. We aren't out hunting for profit, as many are. We are out to make sure that you are getting the best protection, most technology efficiency out of what you're doing in a way that pushes your organization forward. That's what we are providing. We don't have any other agenda like Bob in accounting might have. You don't know. We might have an agenda. We don't. We're here to do the job, make sure you're getting what you need, and making you a happy, compliant customer. Well, thanks for joining me today for getting started with HIPAA compliance. I hope that you learned something. I hope that this was valuable. I hope it was time well spent. If you're interested in finding out more about our services, if you're interested about finding out about how we can help you become compliant, please scan the QR code on the screen, fill out the form. We will be more than happy to have a conversation with you about where you are and what help you think you need, and then see where it goes. We can also help you with your networking, your overall security posture, your technology support. We have many services that we can provide to help you not just be compliant, but be efficient. Thank you very much. Have a wonderful day.